Good Monday to everyone. Today, Orange County Mayor Demings will discuss the positive cases. He will also talk about the work of the Economic Recovery Task Force, our strikes team's formation to increase compliance, and our goals for the week and more. Dr. Raul Pina from the Florida Department of Health in Orange County is here as well, and will provide information on our testing numbers, testing timeframes, and other important data. We begin with Mayor Demings. Mayor?
Okay, good afternoon to all of you. Thank you again for being here. Let me start today by once again thanking our frontline workers, our healthcare workers, individuals like Dr. Pino and the nurses and others who have been working tirelessly now for months to respond to the COVID-19 pandemic in our community. But I also want to do something today. We have our sign interpreters who are here. They have been working with us now for months as well, and sometimes forget to recognize the help that they are bringing to ensure that we effectively communicate.
I should say, please do not let your guard down. It will come up if we do that. We have tested 211,000 people in our county, and the range is from 0 to 103 years old. And when we say 0, it's always, less than 1 year old. With regard to the fatalities, we have 119 fatalities in our list. The age of those fatalities is from 33 years old to 103. The race of the new fatalities added to our list is 47 white, 24% black, 12 older, 6% Asian, and with regard to ethnicity, 25% of those were Hispanics. The individuals have underlying conditions that included hypertension, atherosclerosis, cardiovascular disease, diabetes, dementia, COPD, and fibrillation. Our thoughts and prayers with the families. And we also conducted additional analysis on who these individuals are that are dying. And many of them are in multi-generational family living arrangements. And we want to reinforce again that concept. Where you have an older population living with people who are younger, you have to take extreme care of those individuals that are older in your household and keep it to a distance as much as you can and protect it as much as they can within the house. Because those who are going in and out more often could bring the virus into the home. Another data that we have with regard to the pandemic is that last week, which was week 29, we have a growth of 32% on the number of cases with regard to the prior week. Although the prior 2 weeks to that, we saw a decrease. The interesting part with the data, and this is where people can get confusing, is that although our numbers absolutely increased because the number of tests that we perform, we also have a decrease in the overall positivity rate because there is a large number of negative tests that has been conducted. So that's how the question comes. Because some people could say, okay, you are talking about 340 cases in a day. You also are talking about 30% increase with the prior week, but you are going to say that our positivity rate is decreasing. So the increasing is absolute cases when you compare to the prior week, without taking into consideration negative tests. It's just absolute number of positive cases. So our rolling average positivity rate for the last 14 days, and this is the one that we follow the most in our department, is 15.92. Now, this is coming from the highest on July 8th, which we were at 20.09. Now, this positivity rate, we cleaned it up a little bit. We took out all the MLS testing and all the MBA testing, because although they are in our county, because they get tested so often, and they are mostly negative, it will skew the data in showing a result that is less than what the reality is because of the high number of negative tests. With hospitalizations, we have a total of 619 people hospitalized. That is the highest number we ever had during the pandemic. Although in consultation with the hospitals and the data, we can see that the rate of which those hospitalizations are happening is also decreasing. And we also have the highest number of people on ICU beds too, 113. We also have seen a decrease of visits to the ER, which is the first positive sign that we always look for, and a decrease of the number of visits for what we call COVID-like syndrome and flu-like syndrome. And those are also declining. And it has been a decline of the number of ER visits for cough and for fever, which is also critically important to us. Now, separately from the pandemic, we started today our back to school immunization event, and we are scheduled for today 150 families to come and get tested. All the steps have been taken as a precaution to prevent or to deter transmission of the COVID in the environment. We are at the West Coast Mall. People can call 407-723-5004 to make an appointment. We have a scheduled 3 weeks of vaccination, but if we don't have the demand, we'll not shrink it until we serve all those who want to be vaccinated. It's critically important to vaccinate our kids into going to school for when the school opens, as we will not like to see an outbreak on top of a pandemic. Thank you.
Okay, we'll open it up for any questions. I have Ms. Martha Irizarry, who will help translate if the questions are in Spanish, and we also have Commissioners Mayra Uribe and Commissioner Maribel Gomez Cordero, who are here, and they can answer all the tough questions in Spanish. All right.
Mayor Lauren Seabrook with Channel 9. 2 questions for you. Last week I'd asked you about penalties, and you had mentioned that you thought penalties might be likely coming this week. And I noticed this morning the task force work group took that out of any of its conversation. Looking forward to the task force meeting tomorrow. Where are you at with that? And then secondly, at the convention center, I understand there's about 10 people quarantined that are employees there. Does that concern you as we're moving forward with some of these new shows and events and stuff, how that might impact any of those events?
Okay, in terms of whether or not we will attach penalties to the order, at this point, my observation is that each day we're gaining additional compliance. And so our strike teams, I really want them focusing more on the bad actors, if you will, those businesses that seem to struggle with compliance. And so we're moving forward with that as a strategy. In terms of the penalties, at this point, I think the Economic Recovery Task Force did not believe that it was the right field for our community at this time. We are seeing general compliance. I can tell you that over the weekend, every business that I went in to, they thought I was there to do compliance. So, as a former law enforcement officer, I know what that looks like. So that's kind of what we want. We want to hold people accountable as we hold ourselves accountable to managing the spread of the virus within this community. In terms of the convention center received the Global Biorisk accreditation, which affirms that we have some of the state-of-the-art sanitary measures being put in place and are in place there at our convention center. To date, we don't know any type of outbreak associated with the activities there at the convention center. So that gives us a glimmer of hope going forward to how we will manage other events that may occur at our convention center. So this is all about getting better as a community with living with the virus amongst us, and at the same time trying to stop it from spreading amongst us. So when we wear the mask and we do all of these various things collectively, we're able to slow the spread down. And that's essentially what Dr. Pino is telling you today, is that we see a deceleration of the spread of the virus within our community. So that's what we want to see. And then as it declines with business and commerce reopen, we want to sustain that for an extended period of time. So we have to stay vigilant in the process as we move forward.
It's Steve Hudak from the Sentinel. I'd like to direct this to Dr. Pino. You said that we have 619 people in hospital beds, which is the highest ever, and 113 ICU beds, yet you see positive signs. Can you maybe elaborate, amplify that a little bit?
So, you know, the interesting part with this pandemic is that one data point doesn't give you a whole picture of the pandemic. So you have to look at several data points to try to form an idea of what's happening. And the data is only good at the data that is collected and transmitted to us. So I'm also keeping in mind that there are a high percentage of people who go asymptomatic that may not be even reflected in the data. But what the data is telling us is that it goes pretty systematic. You see, we getting undisciplined on these measures. You see an increase in the number of tests. You see an increase in the number of ER visits. You see an increase of hospitalization first. You see an increase of ICU bed usage, and then you see an increase of the number of deaths. So 50% of the people who are in ICU potentially could die. So we have 113. So we could have another 50 additional deaths just from that number if we follow the data that is being percolated around the country with regard to frequencies and what happened. Now, the mayor was also describing how different our pandemic is from Miami, that is only 200 miles away from us. So part of that difference is also that our county is younger in many than our surrounding counties. So we did this data. You have to look at the positivity rate, especially the 14-day average, because that's when people are most infectious, in those 14 days. So that's an important rate to look. What happened in March has less significance for what is happening today, although the state does follow positivity rate over the pandemic as a whole. We also are very interested in where those deaths are occurring, because what we want to prevent is a situation like what happened in Washington state, in the state of Washington, where you have 40% of the residents of a home, a assisted living facility, who die because of the virus. So the state has been very aggressive with the assisted living facilities. And in many of those facilities, individuals get tested every 2 weeks so that we can detect cases. And most of the cases that we have detected in assisted living facilities right now are asymptomatic tests per individuals. So meaning that we are proactively looking before they even develop symptoms so that we can prevent. And with the hospitalization, there are few things that you have to look in hospitalization that the numbers by itself don't give you out. First, hospital even were not able to discharge if individual didn't have more than 2 tests negative for 24 hours. 24 hours we needed to test after 10 days from onset of symptoms. So with 10 days or 7 days of test result, hospital were holding people longer than necessary. So that plays in the whole hospitalization, not in the ICU. Those are different. And Also, the hospital have mentioned that they have a number of people that don't want to be discharged because they don't have the adequate conditions at home to be isolated, or because there are other family members that are immunocompromised or have some, dire situation. So it's multiple data points, not just one, that help us to form the picture. Now, I talk about hospitalization not to take away from the fact that we are at the highest point of hospitalizations.
This is Melissa Thomas of Florida National News. My question is for you, Dr. Pino. You talked about the importance of keeping a distance in a multi-generational household for the older residents in the household, but talk about the consequences for protecting against the children that develop the virus or syndrome that's connected to COVID-19. I think it's MISC. I think that's the name of that particular disease.
Yes, it's an inflammatory syndrome that has developed in few children. Although kids are not as affected as adults with the disease itself, although there is new studies saying that they are likely to be asymptomatic carriers of the virus, which makes things a little bit more complicated. With regard, I don't have much information about the syndrome itself regarding to the data, who develops it, what percentage, and what the gravity is. But a few kids have developed and has been serious enough that the CDC has sent alerts with regard to this. I don't know if we have one in our county yet. So I will look for that information.
Eric Sandoval with News 6. Dr. Pino, if you could talk a little bit about the vaccine trials that are happening here in the Orange County area. I know there's a few of them. What is the Florida Department of Health's involvement in that, and what's your hope from it?
So, NOAS, the Orlando Immunology Center, which is a clinical facility that specializes in infectious disease in our county. I believe they are in Mills Avenue. They've been selected, I believe, for one of the vaccine, and they are applying for two more. But it's not the Moderna vaccine that is in Miami. Our role is going to be, we are in conversation with them to help them to recruit the number of people that they need for the trial itself. We are working with them to get engaged in that, and they continue to apply for additional vaccines, but they will be in a better position to talk about, how they apply, how they get it, how they were member of that network of very selected people that have been selected around the country and the world to try the different vaccine candidates.
Dr. Pino, Danielle Lama with Fox 35. We've been contacted by people talking about getting in line to be tested, filling out the paperwork, changing their minds, and then leaving, and then still getting a test result. Has your office gotten any questions about that, or concerns, calls?
Could you repeat again?
So we've been contacted by people about folks who are waiting in line for a test. They fill out the paperwork, and then they decide, I don't want to wait. They don't end up getting tested, but they still get a test result.
No, this is the first time. It would be great if I can know, and you can give me the name and the day of birth of one of those individuals, so that we can search the databases to see how often that will happen. It shouldn't happen. So I imagine, and I want to search it to see how often it had happened. It could be that someone, when you enter your information, it could be that the paperwork went and got into the data entry, but they should not be getting a callback because there is not test attached to the data entry. So that's what I want to see. And thank you.
Mayor, Bob Hazen from West 2 News. On that issue of the fines, again, I know that the working group decided they kind of wanted to go with the friendlier approach this morning, but I mean, the very fact that you have some businesses that can be classified as bad actors when it comes to mask wearing and social distancing, if it gets to the point where nothing is working as far as educating them, talking to them about the requirements, what kind of penalties could come down the road if it gets to that level? I mean, is there a way to impose fines if it gets to that level?
I think I will have some authority to issue an executive order that could have penalties associated with it. And when I make public policy decisions, I try to make that based upon the most current and accurate information that I have available at the time. And so while these strike teams are going out, they will be gathering information and intelligence or data. And if we see where there's a significant number that's not, if we feel that that's something that's right for this community, I will not hesitate to use my authority as the county mayor and the emergency manager while we're under a state of emergency to issue an executive order that attaches penalties to it.
Good afternoon, Mr. Mayor. Curtis McLeod with Spectrum News 13. For you or either Dr. Pino, I know that a lot of people in the community rely on the state database, the numbers, but as of late, there's been a lot of questions surrounding that data set, surrounding the numbers, a lot of confusion. What do you say to the community who, like yourselves, you have it up there on the screen, they go to these numbers for guidance. They look at these numbers to help them determine whether or not to send kids back to school, to whether to keep businesses open. What do you say to people who are really not sure or very unsure about the data set, about the state numbers? I mean, do you all trust these numbers? Should they?
Do you trust my numbers?
I'm going to say every single day we have a conference call where representatives from our hospitals, the major hospitals, the Department of Health, and our own Orange County Health Services is participating in that dialogue. Then we use the feedback that we get from the public to try to validate what we are really seeing and experiencing here in this community. The numbers may not be 100% accurate, but I believe that the totality of the numbers that we have gives us an accurate picture by which to make public policy.
I think the mayor put it better than I could, really. I'm going to copy that one. So the reality that the public have to understand is when you have a data set of this size, it's massive. It has 250,000 people already in it. So you are prone to have mistakes. When you have multiple labs collecting data and the people collecting the testing stations are also collecting data. So it's a lot of opportunity for error. And there's also some manual data entry with some of the labs that aren't reporting electronically. When you key responses or data, it also prompts itself to errors. So with that said, the data overall has been very accurate into portraying that picture that the mayor was talking about. Now, there has been corrections and things that could have done better or data points that I would like to have that I don't have. But Orange County, or that the state is not providing, but Orange County have the fortune of having a large health department that have the ability to do those analytics. So every single data that comes into our county is double cleaned and screened by our own epidemiologist. And so we send the feedback to Tallahassee, and what is corrected, and sometimes it doesn't need to be corrected. But I haven't seen any unwillingness from Tallahassee to correct errors that we have detected. But those errors have not been massive in a way that will skew the data in one direction or another.
This next question is texted in from Mike Schneider with the Associated Press for you, Dr. Pino. Now that all Disney theme parks are open, have there been any reports of virus spread either coming from workers or visitors? And can you provide the same status update for Universal and SeaWorld? So
outbreaks, no. We had isolated individuals that had, that had become positive. Now, remember, we rely on the data that is provided by individuals. So it is self-reported. So someone could lie to us about where they work, where they live, or what the situation may be. So having that into consideration, we haven't seen any large number of positive cases coming with tags that identify them to any of the parks.
This next question was texted in from Heather Bailey from 10 Tampa Bay for you, Dr. Pino. Governor DeSantis mentioned today in his press conference having DOH go back and look into the deaths reported to find and identify cases similar to the motorcycle death. What steps will local DOH be taking to look at previous and future deaths?
We look at every single case. Now with the test itself, it's harder because the database is huge. But with the death, because it's a small database, we are able to look at every single cases and go into the data even deeper. And the person with the motorcycle accident is now the first individual in our data set that we have identified and have questions about it. There have been people who have died in our county because we have regional health centers that live in another counties that were initially assigned to us. We will have that debate and that conversation. So in response to the question that he asked, it's the same. We exchange information with Tallahassee. We double check. Remember, they do the data for the entire state. So it's even harder for them to clean up that data. So when it comes to us in smaller numbers, then we can take a second look at it.
Thank you. These last two are for you, Mayor Demings. This one's from Stephanie Bufamonte from Fox 35 in regards to the strike teams. Mayor, if there are businesses who do not follow the executive order or do not comply even after the strike team gets involved and educates them, what would be done?
If they're non-compliant, we're going to use the regulatory authority at various levels of government to gain compliance. That could be from the Department of Business and Professional Regulations, could be from the Department of Health, it could be our local code enforcement authorities. So we'll use the breadth of what we have to gain compliance.
And this last one comes from Ryan Lynch from the Orlando Business Journal. Mayor Demings, how is the county looking at measures like curfews taken by other Florida counties in its own planning?
The institution of a curfew isn't totally off the table, but at this point, we have debated the merits of reinstituting a curfew here in Orange County. We've had the conversation regionally across the counties because of the way our workforce is dispersed and where they live. There was not any consensus amongst the regional counties to enact a curfew. And so I'm somewhat respectful of that. But if we saw a very worst case scenario develop here in Orange County, that's one of the tools we have within our tool bag to be able to restrict movement as opposed to retreating back to a various phase. I'm not sure, given the governor's current executive order, that I, as a local county mayor or official, have the authority to be more restrictive than the governor's order. And so I have to put that into context. But what we can do is sometimes look within that we can lawfully do. So at this point, the curfew is still in our tool bag, but not something that I'm willing to pull out at this point and begin to utilize.
There was one more that just got texted in for you, Dr. Pino, from Eric Levy with News 13. Are you able to give an idea on the numbers following the 4th of July? Are we noticing anything that would show signs of a concerning spike related to that holiday in the data?
No, so far.
Thank you.
Okay, that appears to be the final question. So, commissioners, you all got off lightly today. No tough questions in Spanish for you, but thank you all for joining us today, and we'll be back in touch soon.